What if one day you're walking through a store and somebody falls on the floor? Suddenly you realize their heart is not beating. What are you going to do? CPR would be a great first step. The American Heart Association states in 1 year alone, 475,000 Americans die from a cardiac arrest. Globally, cardiac arrest claims more lives than colorectal cancer, breast cancer, prostate cancer, the flu, pneumonia, auto accidents, HIV, firearms, and house fires combined. If CPR is done, it can double or even triple a person's rate of survival. However, it must be performed in less than 6 minutes after the accident to prevent the chances of brain damage or death from occurring. CPR stands for cardiopulmonary resuscitation. It is used for people who are unconscious or not breathing. CPR is a procedure to support and maintain breathing and circulation for an individual who has entered respiratory arrest and or who has entered cardiac arrest. Respiratory arrest is when someone can't breathe, and cardiac arrest is when someone's heart is not beating. They both can be caused by several different reasons, including allergic reactions, choking, or drowning. CPR consists of two main steps: chest compressions and rescue breaths. A chest compression is to help circulate blood, and rescue breaths is to give oxygen to the victim. The correct ratio would be 30 chest compressions to 2 rescue breaths with a rate of 100 compressions per minute. In CPR class, you would learn that the song "Staying Alive" by the Bee Gees is the correct way to get this rhythm. Make sure to always use a mouth barrier, even if it's somebody that you know personally. CPR can be performed on anyone, infants, children, or adults. However, there are 3 different side ranges to determine what technique to use. The Mayo Clinic staff refers to these ranges are infants 4 weeks old to a year old to puberty, and anyone older than puberty. Each category is slightly different in the procedure. There are a few stipulations when you would not want to perform CPR. In February of 2019, the Mayo Clinic says to not move a person who could have a back injury or a neck injury because it could cause serious neck injuries and permanent paralysis. Just like anything, CPR has also downfalls. However, receiving CPR and having these downfalls is a lot better than having brain damage or possibly dying. If CPR is done the correct way, it can result in broken ribs, bruises, and damage to internal organs. In 2010, Lee Colbert, who has a PhD, wrote, "Partially successful CPR may result in brain damage, and unsuccessful CPR results in death." CPR is still needed to save someone's life. After CPR is performed successfully, emergency medical care is still necessary. However, CPR should never be used on a healthy person because in 2018, Lori Beck inferred that if CPR is performed on a healthy person, it could cause a serious injury to their heart. Maybe you're CPR certified, maybe you are a healthcare professional, or maybe you're just a good Samaritan. Whatever you may be, everyone can perform CPR. If somebody in your presence needs CPR and you're not certified, then someone can instruct you in doing so through 911. The American Heart Association states, however, that in the event of a suspected cardiac arrest, even CPR performed by an untrained bystander who receives instructions from 911 emergency dispatchers is more beneficial than the risk of injury in a person who is actually not in cardiac arrest. The American Heart Association and the American Red Cross have the same CPR training and guidelines. CPR certifications must be renewed every 2 years. Among others, medical personnel and emergency organizations hold classes for people to become certified or to get recertified. The American Heart Association has also developed a 22-minute self-directed program called CPR Anytime. You cannot become certified by CPR Anytime, but you can learn how to be prepared if you are ever in such a situation. To conclude, CPR can be performed on any person that has entered cardiac arrest or respiratory arrest. It consists of chest compressions and rescue breaths. CPR also has downfalls just like anything else, and it is easy to become certified.